Amanda here with StraightSmile Solutions, and today we're going to talk a little bit more about retention or retainers and how to pick the right retainer for your case. There's no one size fits all approach for this. It's really how it needs to be customized for each case, depending on the occlusion or the bite or the condition that the patient had at the beginning, their growth, and really, finding the right fit for each patient. So some patients come in with kind of a predisposed belief in what type of retention they want. Maybe somebody told them about it, or they read something on the internet, or their friend had something special, but that doesn't mean that's the right retention for that patient. Now, I know for me, I've had every type of retention that's out there at one point or another after my orthodontic work. And for me, the right fit was definitely a Hawley. I know a lot of people think that's old school, but I didn't like Essex retainers. I just didn't like the fact that it felt like you couldn't bite down fully, and I felt like not all my teeth were balanced. So I liked getting a wraparound Hawley so that all my teeth felt balanced. It also like removed a lot of like headaches, tension headaches, issues with TMD. For me, that was the right fit. I can't promise you that's the right fit for you or your patient, but there are four primary retention choices that I like to talk about, and we'll kind of go over the highlights for each one. So the first one we're going to talk about is probably the most contentious. It's the bonded or permanent retainer. Um, don't get me wrong, there are plenty of people walking around who've had a bonded retainer for 10, 20, 30, 40 years, and it's working just fine for them. And that's wonderful. Part of that is how well it was made, how well it was adapted, how well you were a good case for a bonded retainer, how well you keep it clean. Um, so there's a lot of variables that go into that, trying to get that right fit for a bonded retainer. Uh, for me, if you're going to do a bonded retainer, I like the sinus shaped bonded retainer. It's kind of like almost like what you see here in this picture, this tiny picture up at the top. So you are able to floss still within it. I also like bonded retainers that are only bonded on the ends, the canines, or just two teeth, so that you can get through most of those teeth at least, and they're not completely occluded from flossing. I don't like the bonded retainers that bond on six spots. I don't like those at all because it's just a hygiene nightmare. And I've seen, on the flip side, for as many people coming in and asking for a bonded retainer, I feel like I always have to spend a lot of time convincing people they really don't want one, because I'll go over all the risk benefits and alternatives, and they'll kind of see the risk that can happen. Most hygienists hate bonded retainers because they see what happens. The debris, the calculus gets stuck all in it. Patients can get periodontal disease. They can get decay under the bonded retainer. So unless you are just a hygiene fanatic, you're really great at floss threaders, you can get in there, you're really adept at using them, you're using a water pick and a Sonicare, you can get all around the darn thing, then that's great. But if not, don't get one. It's not a good fit for you. Also, the other tricky thing that's going to come up with a bonded retainer is when those things break. If they're bonded on all 6 points instead of just two, the bonded on two I feel a little better because if one breaks, it's pretty obvious. But the ones that are bonded on all 6 points, if one gets loose, you may not know that it got loose. And then what's going to happen is that tooth that's no longer attached is going to start moving forward or rotating. And you won't notice it till you see it. And by then it's too late. Because now we got to take the whole thing off and we got to do either braces or aligners all over again. At this point, there's probably no way to fix it with a retainer itself. So that's one of those important things to know, okay? So we talked about benefits of bonded retainer. It can be made in-house. That means the doctor can bend it, can customize it there, or it can be 3D printed. It can be custom cast and made in the lab. That's my preference. That way it's really well adapted. If you have what we call an active bonded retainer, and that's a bonded retainer that's made, say, with a braided wire or something like that, it's a multiple strand wire, these things, they can become, like, again, they actually could be active theoretically. So if they're not put on right, or if they kind of quasi unravel, it'll actually move the teeth just like braces. So all kinds of troubles can happen. And I like to tell doctors, if you place a bonded retainer, you're married to this patient. As a matter of fact, I tell them you're married to this patient for life. So it doesn't matter where the patient goes unless you came up with a plan for that bonded retainer as to not, maintenance, what happens when it breaks. You had an actual warranty with the patient. You had it written down and signed exactly who's responsible, who's not responsible. You're responsible. So you need to be, if you put this in your patient, you need to be checking on them. And if they up and move someplace else or you lose touch with them, that's your responsibility to get back into touch with them. or to release the patient to somebody else's care. So that's why I don't recommend placing bonded retainers in patients that you don't have a long-term relationship with. It sounds weird, but what else? What else? We kind of went over all the benefits for bonded. Let's move on to Essex Retainer. So Essex Retainer is a brand. It's kind of like I call it Kleenex or Charmin. Essex is a brand of clear retainer. There's tons of brands of clear retainer, and most people just call them Essex type or Essex like retainers or a clear retainer, you know. But that's, like I said, Essex is just a brand, like McDonald's is a brand, right, for hamburgers. But not the best analogy. But anyways, Essex is great. You know, I'd say it's the most common retainer you're going to see now. They're very fast. They're very aesthetic. You can make them in-house. That means a lot of doctors can just make them as needed on the spot within an hour or two in their lab in their office. Sometimes they send them out to another lab. But one of the cool things is with Essex Retainer is that if you have one and you're like, oops, you know, you forgot to wear it, you went to camp for a week and then, okay, you put it back in your mouth. Well, the cool thing is if there's a tiny bit of movement, it'll just move it back, just like an aligner. Now, if it's too much movement, the Essex itself will not move it back. You could use something like a vibratory device to try to get it to settle in a little bit more. You could try chewing on chewies. That'll help it out. But that's the cool part about Essex Retainer. The bad part about Essex Retainer for me is that very rarely when you get your braces off or when you get your aligners done is your bite really balanced and settled. So maybe you're biting on the right side more than the left side, or the left more than the right, or the front more than the back, and the Essex will just preserve that bite the way it was at that point, and you'll never get a really harmonious long-term bite, which is why I'm not a fan of them for immediately after you finish your braces. Not most of the time, maybe sometimes, but what else? They're not meant to last a lifetime. They're meant, on average, they start getting deformed, distorted, maybe 6 months to a year, which is why most people need to buy them in packs or bulk. I would recommend if you have this retainer to have a plan to have it replaced on a regular basis. Don't wait till it starts to wear out. You're not even going to know when it wears out. Wearing out doesn't mean it cracks or breaks. It can become deformed or distorted over time and you're not going to know. So you need to be regularly replacing these. So if you got this as your final retainer, there's lots of options, you know, and I think there's more options even coming in the future, but this is something that needs to be replaced regularly. If you're 18, you're going to need maybe like, you know, 50 more Essex retainers. I mean, honestly, you will. So you need to have a plan. So, and I think a lot of times we just abandon our patients and we're like, bye, you know, braces are off. Bye-bye. See you later. Call me if you lose your retainer. But if you have an Essex, you need a long-term plan. Talked about Hawley already. It's kind of old school, but it works for a lot of people. For the doctor, can be a little bit expensive sometimes because you have to have that custom made. And lastly is the one I guess like to say old school is new again. So one of the oldest original retainers before they're really, maybe Hawleys were still around, but definitely before aligners and maybe before bonded retainers were routinely used, at least they were with bands, but not bonded, was the positioner. And it's like the original aligner. It was invented, I think, in 1943 in Indiana. And these things really, really do a great job, not only at keeping the bite, maintaining the bite, but also helping you breathe through nasal breathing, helping with the airway. They're fantastic long-term retainers. That's what a lot of people had, you know, in the 60s and 70s. That was their retainer, the positioner. A little bulky, but there's tons of benefits to it. And I mean, people forget, they're thinking the overall price. Well, you know, a Hawley is say $100 or $80 each. Well, the positioner's only one retainer because upper and lower is all in one. So actually it could be cheaper. So, and it lasts like forever. So that's my other, you know, favorite kind of old school is new school retainer option. So anyway, sorry that was a long diatribe today, but hopefully you know a little bit more about my thoughts about retention. If you have any questions, don't forget to follow our YouTube channel, subscribe, go to our website, StraightSmileSolutions.com, and check out our blog. And if you need help with your ortho cases, you can schedule a complimentary consultation from our homepage, and then we also take private clients. All right, thanks so much. Bye-bye.